Ortiz here. Today I wanted to do some techniques and stretches that you can do to help relieve pain that comes from migraines. A lot of people that suffer from fibromyalgia also suffer from really severe migraines. And having a migraine can be absolutely debilitating and completely ruin your life. And so these are going to be just some really easy stretches and ways that you can help to relax the muscles that could contribute to a migraine and help to relieve some of that pain. So oftentimes when we have a migraine, the pain could actually even originate from the upper part of our back, because our trapezius muscle is actually a muscle that goes all the way up, to the bottom of our skull right here, as well as a muscle called your levator scapula. And so stretching out the mid to upper part of the back could also help to relieve that pressure, because if those muscles are feeling tight and you're having some spasms or discomfort there, those muscles could actually pull on the muscles that surround the skull, and that could cause pain and discomfort, and as well as a migraine. And so the only thing you're going to need is going to be just a tennis ball, just a basic tennis ball. And this is if you don't have anybody to assist you, because some of us, there is actually a great technique that massage therapists do called occipital release, but you need someone present, you need someone there to help you perform this, and some of us don't have somebody that can help us, so these are ways that you can stretch it by yourself. So the first stretch is going to be real easy. All you're going to do, you're going to take your hands behind your head, and you're just going to pull your head down toward your chest. And when you're doing the stretch, you can use one hand or you can use two hands, as long as you're not pulling too hard. But you're really lightly just going to pull on your head and just pull it down until you feel just a nice stretch. It shouldn't be too painful. It shouldn't be too aggressive. And you're going to hold that stretch for about 60 seconds. Again, just to give that muscle some time to release and to relax. And then from there, you're going to go on to a lateral stretch, and this is going to be for your levator scapula to help release that muscle. And you're going to put your head at a little bit of an angle, just a tiny bit, and then you're going to take one hand and just slowly pull your head to the side. And you should feel this muscle right here being stretched. You should feel a pull right there. And again, it's always just a nice gentle pull. And of course, you're always breathing whenever you're doing these stretches, because that will, help your whole body just to relax. And then you'll do the other side. Again, your head will be at just a slight angle, and then you pull it out to the side until you feel just a nice gentle pull on that muscle, that levator scapula. And you'll actually feel whatever angle your head is at. If you kind of lightly adjust the position of your head, you'll feel even a more intense pull on that muscle. So if your head isn't quite at the right angle, where you feel like you're not really getting a great stretch, just kind of move your head around a little bit, and then you'll kind of feel like, okay, I'm feeling it now. And then you'll feel where that muscle is being pulled, and you're giving it the most beneficial stretch. The next one is a stretch that I call the hug stretch. And so there's a couple ways to do this. I will show you the more difficult way, but first I'll show you the easier way to do it, where all you do is you give yourself a hug. You put one hand on each shoulder and you pull your shoulders down, and you actually are, consciously you're pulling them down, and then you're gonna, again, bring your head down to your chest, and you're gonna round your back forward. And again, that's gonna just stretch out your trapezius muscle. Also, just help to open up your scapula as well, and just stretch out any tightness that you have in the upper part of your back. And then you switch to the other side. Again, I'm consciously pulling on those shoulders, pulling them down and rounding my back. And I'm like digging my chin into my chest as far as I can. And again, you'll hold that for a good 60 seconds. Now, if you're someone who's very flexible, you have really skinny arms like me, you might be able to do an even more intense version of that stretch, where you would take your arms and you would wrap them around like this, where one elbow goes on top of the other one, and then you'll kind of wrap your wrist around and grab your hands like this, and you would do the same thing. And so this is definitely a much more intense stretch and version of the one that I just showed you. And again, this is for people, you know, that might have, you know, skinny arms and have that flexibility where they can actually wrap around their arms around like that. But if you if you have a lot of tightness, or you don't, you know, maybe you're a big guy that's kind of thick with big arms, don't attempt it, because you might actually hurt yourself if you're a little apprehensive about doing that version. And the last technique I'm going to show you is just going to be an occipital release with using just a baseball or a tennis ball, whatever you have. And so with this technique, I'm just going to lay down. And again, as I've said in many other videos, it might be a good idea if you have a pillow just to help neutralize your back. And so I'm just going to take my ball, and you're going to, if you put your fingers underneath your neck up to where your skull and your spine meet, you'll kind of feel like a little, like I guess like a divot in there, like a little part of your muscle that kind of just goes in just a little bit. And that's where you want to put your ball. And it's going to be on the side of your spine, not right on your spine, but just on the side of it. Again, where the trapezius muscle is going to come up and end, as well as your levator scapula. And so you're going to take this ball and you're going to put it in that divot. And you're just going to let your head, you're going to hold the ball, and you're just going to let your head just kind of rest on the ball. And the more you let your head rest, the more of an intense, pressure that you're going to feel on that muscle. And so, again, you don't want to go too far to the point where it's really painful, but you will feel, if you're really tight in that area, and that area is causing you a headache, you might feel some discomfort just because the muscle is so knotted up and tight, and maybe even spasming, which again could be causing your extreme migraine. And so again, you would hold it here for, for 30 seconds. You can start with 30 seconds in the beginning, because this is a little bit of an intense pressure point technique. And then you would go ahead and just take the ball and you would switch it to the other side of the spine. And again, when you're using the ball, you'll kind of feel where the ball just naturally just fits into that little space. And again, you'll just let your head rest on that ball. If you feel like you're having a difficult time resting your neck when you're doing this technique, you can use the other hand to kind of give your head some support, just so that your neck can relax, and then try to consciously just let your head fall back and just rest on the ball. And if the pressure is too much in the beginning, again, you can use your hand to give your head a little bit of support, so it's a little bit less pressure on the muscle. And then as the muscle slowly starts to release, you can let your head go, and then, just let it completely rest on that ball. And you can also do this technique for your rhomboid muscles. Sometimes ever since my second car accident, I get horrible muscle spasms in the mid to upper part of my back, and I always feel it right around my scapula. And so I'll take the ball and I'll just put it underneath my scapula, and then I'll just kind of roll around on it and lay on it like this, and just kind of roll around. And again, it's a pretty intense pressure, that you'll feel on the muscle, but it really does do an amazing job in helping to release, again, any type of muscle spasms or tightness that you have that could be causing you pain or discomfort. And so that's another technique that I try. For the one that I just did, it might be easier for you in the beginning to do it on your bed, because when you sit on your bed, like, the mattress has some give, and when you lay on the ball will kind of go into the mattress a little bit, and so the pressure won't feel quite as intense. and it'll be a little bit easier for you to kind of, you know, move the ball back and forth in order to work on that knot and release that pressure, that spasm that you might have that's causing you pain. And so that's another technique that I do, and it really does help me tremendously. So again, initially you can try doing this on your bed, and again, obviously with the pillow underneath your head. And then as you get more comfortable, as that muscles start to release, then you can go onto the floor like I am right now. And as you can see, I kind of have to lift my body up in order to do it. And so that's another, I guess, discrepancy that you have to consider when you're doing this release technique. Because if you have low back issues, if you're not quite in a position where you can lift your body and hold it up like that, then I would, again, recommend that you hold off of this one until you feel comfortable being in a position where you kind of have to hold yourself up and move yourself up and down. And so certainly keep that one in mind when attempting this one. And so those are just some great ways to help to relieve the pressure from a migraine, because I know I'm personally not someone who has suffered from migraines on a regular basis. On occasion, I have experienced horrible migraines. It's very rare, but when I do, it really is debilitating. There is no pain like a migraine. It makes you want to vomit. It makes you want to fall down. You literally can't do anything until the migraine has subsided. And it really is just a horrible, horrible condition to deal with. So before I end this video, I wanted to give a shout out to a really great channel called The Posture Specialist. And I'm going to put a link for that channel in the description below. And this channel is basically a channel that is dedicated to developing good posture. And right now, she's doing a series on foot health. And any of us that know any type of reflexology or any type of natural health know that there's so many different pressure points on our foot that if manipulated the right way, could relieve pain and discomfort in other areas of our body. As well, also how we stand and imbalances that we have in our feet could also dramatically affect our alignment, how we stand, how we walk. And so this is a series that you definitely don't want to miss. So definitely check out Ashley's channel, The Posture Specialist, and be sure to subscribe to her channel, because you will get, I've learned so much from her. You will get so much valuable information that will really help you improve the quality of your life. And just, again, natural ways to deal with pain and get your body into the appropriate alignment. So, all right, guys, so I hope that helped you out with things that you can do to help relieve the pain of a migraine. And remember, if you enjoyed this video, be sure to give it a thumbs up. And do not forget to subscribe to the channel so that you can continue to get more videos and information. As well, the notification bell. You also want to push that notification bell so you get notified when I upload videos to help you improve the quality of your life. Remember, guys, take care of yourself. Protect yourself physically and emotionally. And don't forget, your health is your most valuable asset. Invest in it. Bye-bye.